Now, each year, around 14,000 people get sepsis in Ireland. 1 in 5 die as a result. Many people don't know about the illness until someone they know is affected. Well, we're joined now by Dr. Ellen Hayes, the author of New Advice for GPs About Adult Sepsis, which urges family doctors to be alert and refer patients to hospital if they suspect sepsis. Dr. Hayes, thank you so much for coming in and speak to us this evening. 3,000 is quite a significant number of people to die from something every year, yet lots of people don't really know about sepsis or know how to recognise it. Why is that?
So thanks, Sharon, for having me here this evening. And before we start, I'd like to really remember the patients and their families who are affected by sepsis. They're foremost in my thoughts today. Sepsis is a leading cause of not only death, but it's also a cause of significant disability, which can last for years after hospital discharge. So you asked me, why is sepsis so difficult to detect? Well, it's a very complex condition, which brings me to, what is sepsis? So sepsis really is when an infection in the body causes an out-of-control response. This out-of-control response then can affect many organs within the body and damage them, and it can also cause death. The organs which are commonly affected would be the heart, the lungs, the liver, the kidneys and the brain. And in us, this manifests as symptoms such as breathlessness, a thumping heartbeat, confusion, extreme lightheadedness, extreme fatigue, a rash that doesn't go away when you press, extreme muscle pain, to name but a few. So from this, we can see that it is a difficult diagnosis to make.
OK, so there's a whole range of symptoms. How do you get sepsis?
So sepsis is caused by an infection, and sepsis can affect anybody at any time. It does not discriminate. It is, however, more common in people at the extremes of age and also in patients with underlying health difficulties.
And it's not necessarily something that you might contract in a hospital. The majority of people aren't in hospital when they pick up this infection.
Exactly, Sharon, you're correct in that. It is known that approximately 70 to 80% of sepsis occurs in the community. And that's why I was delighted to formally launch this advice for GPs today. I hope that it will really assist GPs in the early detection and management of sepsis. And the hope is as well that this will increase public awareness of sepsis and promote sepsis within the general practice community.
Because often, because there are so many different symptoms, if somebody presents to their GP, it might be seen as something else or misdiagnosed if it's not at an advanced stage. Is that right?
Yeah, that's absolutely correct. So in the beginning of a sepsis illness, the symptoms might be mild, they might be subtle, and it may mimic other illnesses such as influenza. The presentation of sepsis is very varied to general practice, as you can see from the symptoms that I described earlier. And often in general practice, we see patients early on in the trajectory of their illness. So whilst sepsis may not be apparent on an initial consultation with your GP, it could develop when you are sent home. And that is why it's really important to be cognizant of the signs and symptoms of sepsis and to seek urgent help should you have any concerns.
And is there a test for it? Can a GP do a test for it?
No, so unfortunately there isn't any test for sepsis at the moment, and in general practice we suspect sepsis, we cannot diagnose sepsis. The diagnosis and investigation into sepsis is performed in an acute hospital. So in general practice we will see a patient suspect sepsis and refer urgently if we have any concerns at all.
So for some people I know, if they've gone to the doctor and perhaps it's been diagnosed as something else or they've been given an antibiotic, they might go home, but then they might recognise somebody in their house might see that they've stopped talking, or are they what happens when it's started to get worse? What are the symptoms at that stage?
Yeah, and that's a really, really important point to make. Often the person that's most unwell doesn't realise that they're that unwell. So if you're a carer, you're looking after an elderly person, if you're a mother at home and you have a neonate, it's really important to look at the HSE website on sepsis and familiarise yourself with the signs and symptoms, because you may need to escalate the care of your loved one to the A&E department.
And that's where it's dealt with at the A&E department.
Exactly, yeah.
And is there any way of preventing this? Because you did say there are certain people who are more vulnerable to it, but can it be prevented?
Yes, so vaccination is really important. Vaccination saves millions of lives throughout the world every year, and it is the single most important thing that we can do to prevent sepsis. So if we vaccinate more people, infection rates should decrease, and therefore the burden of sepsis in our communities should decrease. And GPs are heavily involved and play a really important role in vaccination of our population.
And what type of vaccine is that? Is it particular to sepsis, or are you talking about more general vaccines?
Yeah, so I'm talking about general vaccines. There is no vaccination for sepsis. But what vaccination does is it decreases infection rates, which in turn decreases the burden of sepsis in our population. So the vaccines that we really need to promote are the influenza vaccine, the COVID vaccines, the pneumococcal vaccine, the whooping cough vaccine for pregnant ladies, and also the routine childhood immunisations. And I'd really like to mention tonight the childhood nasal vaccine. This is a really important vaccine and it's freely available in your GP. It provides direct protection for our children and also provides indirect protection for the most vulnerable people in our communities.
All right. Dr. Ellen Hayes, thank you for coming in to speak to us on 6:01 this evening.
Thank you very much. Thank you.